Welcome, folks that have joined so far. We invite you to introduce yourselves in the chat window. Please enter your name and what sector you work in. A few more folks will be joining, and then we will get started in just a moment. Thank you so much for entering into chat. Names and sectors that you're working in. We'll get to learn a little bit more about who's on the call in just a moment. I wanted to acknowledge and apologize. We are going to hear chimes on this call. Unfortunately, the settings were fixed before we began and unable to change them. So asking for some grace and some tolerance with some of those chimings and background noise. And so with that, I'm going to turn it over you'll get an official welcome. So let's stop our share of screen and we'll hear from Don.
Hello, everybody. It's not often I get to do such an august official welcome. I'm very pleased to welcome you to the session today. I'm Don Gips. I'm president and CEO of the Skoll Foundation. And this virtual event is the latest collaboration between Healthcare Without Harm and Skoll. And we have a long 15-year history of partnership. Today I sit in California where the wildfires have been raging for over a month, choking our air with smoke. Some of the cities with the worst air quality index in the world are here in the American West right now. But there's some silver linings. We've gotten our first day of rain in a long time, so hopefully we're starting to turn the corners. There's no doubt, however, of the direct connection between climate change and the health of our communities, as these fires have shown so clearly. Of course, we are also battling with the COVID pandemic at the same time. We've all come to understand how the impacts of the pandemic are disproportionately affecting the most marginalized communities. COVID has had an unjust, outsized impact on communities of color in the United States and around the world. These intersections of climate change, healthcare, and racial equity are more evident than ever before. At Skoll, it's our core belief that strong networks and collaboration are the key to achieving transformative change in societies and in the environment. That's why we're so excited to partner with Healthcare Without Harm and all of you who've joined this call today, because you are at the forefront of the movement to ensure the healthcare sector is leading the way to a healthier planet. We've been pleased to support Healthcare Without Harm in their effort to build a network of healthcare providers committed to fighting climate. That network has grown to 1,300 partner organizations across more than 70 countries. So amongst all the bad news, we see another silver lining. There are amazing leaders and solutions working to drive change on the front lines of these interconnected and interdependent challenges around the world. We look forward to hearing from a number of those leaders today. And I'm going to turn it over to the amazing Gary Cohn to lead us in that conversation.
Thanks so much, Don. And thanks for the partnership with the Skoll Foundation over so many years. It's been truly a wonderful partnership, and we greatly thank you for that. Welcome, everyone. If you continue to hear these little dings, one can think of it as a little meditation bell and reminders to breathe deeply and to hold this moment as precious. So as the world responds to this COVID epidemic and all the intertwined social, political, and economic crises that it has spawned, we find ourselves at a time of collective trauma. We stand at a crossroads. One path takes us back in the direction we came, propping up all the old structures and systems that have led us to this moment of crises in the first place. The other path leads us in the direction of an unprecedented set of opportunities and the urgent need to forge a just transition to an equitable, resilient society that provides decent work for all, universal health care, and contributes to a healthy climate. It is by no means a sure bet that the vision of a transformative and healthy future will prevail in the short term. As we see each day, authoritarian rulers in many countries are using these interlocking crises to dismantle democratic structures, to fuel racist flames, and consolidate their own power. The very same people who are downplaying the COVID pandemic are the ones that are also downplaying the climate crisis and denying the systemic racism that infects so many societies. And at the same time, we have this incredible opportunity to recognize that we are truly interconnected, even at a cellular level, that the health of someone across the street or across the country or across the planet is linked to my health, to our own health, that each one of our futures is wrapped up with everyone else, that a virus that can transfer from an animal to a human someplace on the planet can infect the entire world, that the smoke that is coming from the wildfires in California now is blowing over to Boston and to Amsterdam, that the fossil fuel emissions that go out into the atmosphere affect everybody on the planet. It's a moment where we can begin to awaken our common humanity and awaken the heart of our compassion for ourselves and all other beings on this planet. This moment has also demonstrated that the health sector sits at the epicenter of this collective trauma and collective healing, whether that be from a pandemic or from the extreme weather brought on by global warming. The sector anchors the response to the damages that we collectively face, as well as having a larger healing role in our societies. As we understand the factors that are making people sick in the first place, the social, racial, environmental conditions that they face in their daily lives, we need to marry healthcare and public health to see the community as both the patient, but also as partner in a broader healing, and the environment which sustains us all as the core to the dimensions of people's health, foundational. So around the world, the health sector is leading by example, creating solutions at a local level that also help solve global problems. So in a few minutes, we'll hear from our esteemed speakers, HELGA, GARZA, LAETITIA, RISPEL, NIHARIKA, SINGH, and Maria NEIRA about their leadership and inspiring work. But first, I'm going to turn it back over to Heather, who's going to walk us through how this session is going to unfold this morning.
Thanks, Gary. So hi, everyone. I'm Heather, Equinox with Co-Creative. And so here's the flow, our proposed flow for our 90-minute session together. So in a moment, we're going to get to connect a little bit as a group of people on this call together. And we'll have a specific tool we'll be using to support us to do that called Slido. After that, we'll get to, our intention was really to spark our collective thinking about what's possible. And so we wanted to kick that off with an engaging group of speakers who will help us get connected to their work and some of their inspiration. And then we're going to, after hearing from speakers, we will break into some small groups. So you'll get to connect with one another. And so you'll be able to be in conversation with others who are really working at this nexus of health, climate, and racial justice. And after that, we'll come back together. We'll pull up on some key themes that emerge in your conversations, and we'll get to hear from one additional speaker before we close the session. So I wanted to offer up an opportunity for us to just get to hear a little bit about who else is joining. And so Gabriel, if you could pull up the slide deck. So you'll see two questions once you make your way in Slido to the main room. There's a question around what country you're joining from today. Love to see our broad representation across the globe. And then also in one word, what is sustaining you in these really challenging times that we're experiencing? We've got almost 50 folks in there so far. So here's what's emerging in terms of what is sustaining us in these challenging times. So as the words grow larger, that means more people are entering the same word, right? So a lot of folks are finding sustenance in family and hope and nature, faith, community, love. Great. So I'm seeing some really core values that are knitting us together. Gabriel, I'm going to turn it back over to you to screen share where folks are joining from. While Gabriel's doing that, I'm going to just offer up that also in Slido, while the speakers are having their conversation with Gary, we wanted to also offer you an opportunity to also use Slido to offer up any connections or patterns that you're seeing across their stories. And so a new poll will be activated in Slido. I'll drop the link in again. It's the same link, so please keep that tab open. But we invite you to sort of reflect on what you're hearing as the speakers are sharing their experiences. And again, offer up any insights you're hearing, any connections or patterns that you're noticing throughout that conversation. And we'll have, our intention is to have a few minutes for speakers to be able to go back to that at the close of the their panel conversation, to be able to reflect on what you've offered up. So here is our map of where folks have joined from. Thank you, Gabriel. And if you could advance to the next slide, that just gives you, again, what I've just offered up. We are offering this opportunity for you all to use Slido again through the panel to note any connections or patterns you see. And then also in Slido, if you wouldn't mind giving a thumbs up to things that are resonating with you, we'll get to understand across our group of 211 people so far, what is emerging as some top themes. So last point from me before I turn it back over to Gary is we will be spotlighting speakers' videos, but you might have a better Zoom experience if you use the participant view as opposed to the gallery view today. And so to change that view, you can go up to your right-hand corner and you'll see an icon that says speaker view. So with that, I will turn it back over to you, Gary.
So much, Heather. And obviously we're all learning how to navigate this new landscape of virtual reality. So appreciate that it's complicated and sometimes there's glitches, but it's all going great. So Healthcare Without Harm has been working with healthcare leaders around the world to take on 3 critical roles to address the climate crisis as part of their broader healing mission. The first is to heal the economy. We can no longer support healthy people on a sick planet. Our economy is based on fossil fuels, toxic chemicals, and industrial agriculture, all of which are destroying our health and destroying the health of the planet. We need to heal from an immoral economic language and model that allows people on the planet to become expendable. This is not some side issue to global health, it's the crux of the matter. Healthcare has a unique and powerful role to play in detoxing our economy. In the United States, it's 18% of the economy and it's 10% globally. And it's the one sector of our economy that has an ethical framework, a healing mission to first do no harm. So we're going to talk with HELGA GARZA from the Agri-Cultural Network about how communities can partner with the health sector to leverage its economic clout in service of healthy and sustainable economic recovery. The second role is anchoring this response to the crisis and anchoring the resilience of our communities. This means being able to operate if the electrical grid fails, having stable and proximate supply chains for essential protective equipment and medicines, understanding who are the most vulnerable members of our community in extreme weather events, and being proactive in helping them to withstand the shocks and stressors that they face, including mental health issues, food insecurity, homelessness, racism, unemployment. In the 21st century, decarbonizing the health sector will become a strategic priority, and solarizing clinics all around the world will become a core dimension of universal healthcare access. So we'll hear from NIHARIKA SINGH, former health minister of Chhattisgarh, India, about how this transformation is happening in her state. The third role is around leveraging our voice and political power. So doctors and nurses and public health people are the most trusted members in so many of our societies. The COVID pandemic has elevated health professionals to even a hero status, and rightly so. They've risked their lives so that others can be saved. So we and our allies have been mobilizing health professionals around the world to develop policy strategies that integrate health and equity and climate solutions, to advocate for a just transition to a clean energy economy that protects people's health from air pollution and climate change, and bringing our voices to the larger climate movement for much broader impact. How can we be truth tellers in a moment when lying at the highest levels of government has become a daily assault? Today, we'll hear from LAETITIA RISPEL, immediate past president of World Federation of Public Health Associations, and a leading health voice in South Africa. And then after the break, we'll hear from Maria NEIRA, Director of Public Health and Environment of the World Health Federation, about how to build public-private global partnerships. Maria is a passionate and treasured leader advancing a strong climate and health agenda. She has worked tirelessly to partner with health ministries and nonprofit organizations all around the world to build a climate movement inside the health sector. And we've worked with Maria and her team over the years to actually win a global treaty phasing mercury out of the healthcare sector. So these four powerful women represent four different prisms and approaches to solving global solutions related to climate, health, and equity. All point to strategies that we need to scale and spread across the world. And honestly, it's an honor for me to be facilitating, sharing their voices with you today. So let's start with HELGA. So take yourself off mute, HELGA, and tell us, how are you partnering with the health sector to address systemic racism and underinvestment in communities, and partnerships that are supporting sustainable agriculture in your region?
Good morning, everyone, and thank you for allowing me to be here amongst such dedicated people committed to the cause, to moving us forward. Our organization, Agri-Cultura Cooperative Network, is in the South Valley of Albuquerque, and we work with small-scale farmers, all using sustainable and regenerative methods in growing food and making our production local and accessible to our communities in need. The South Valley is, part of it is unincorporated part of Bernalillo County, and we have a long biased history on lack of investment, unhealthy zoning and permitting, and the list goes on. So our outcome is living within all of those social determinants of health that have manifested throughout, I don't want to say decades, I want to say generations. Since 2014, our organization started working together collectively with the healthcare institution in a program, Healthy Here, sponsored by Presbyterian Community Health. It's a program that's sponsored by the CDC, Center for Disease Control, Prevention Cooperative Agreement, and it is called the Racial and Ethnic Approaches to Community Health. That collective is what really brought all of our frontline communities together to really strategize on how we were going to build a mindset within our communities on healthy eating and active living that involved our organic farmers, We wanted to also lay a platform for an economic driver that is addressing social determinants of health. And this collective within Presbyterian, CDC, and Healthy Here made all of that possible. Like I said, we've been at this since 2014. Since then, we have built really strong trust, because it is a top-down approach still, but this was a top-down approach with a different mechanism in it that put the forefront communities at the leadership of strategy. So that is one of the ways we've been working with healthcare institutions. And I think all of the work from that piece has really given us both the healthcare institution and the frontline communities working on community health, really an understanding of what those two entities were, are, and how we can collectively work together to meet our goals. Since then, we have really worked even closer with Presbyterian Community Health in building our sacred roots. They have invested in our local economy in agriculture. They have invested in our foundation as far as getting ready for future production. They funded a greenhouse of ours in Sacred Roots. And we continue to build. We do work with University of New Mexico Hospital as well, doing community nutrition classes and doing other outreach programs with UNMH. So for us, it's always been about that bottom-up approach, speaking for ourselves and working with the self-determination of people. So it is we are very fortunate that we have healthcare institutions that do want to work at community health together. And that is the approach that we are taking.
It's interesting that healthcare is economic anchor in the community and actually uses its purchasing power to support sustainable farmers in the community. They can support a community of color farmers, people of color farmers in the community, as to provide guaranteed markets. And also, I think in your model, also there's a real integration of food as medicine, as a piece of what it takes to make people healthy. Could you speak to that a little bit?
Well, like I said, we are organic farmers. We are sustainable, regenerative. And so our main piece here is not only take care of the health of our people, but also take care of the health of our soil. We are in the high desert, so water is always an issue here. We are fighting gentrification within our farming community. And so for us, the economic driver has to be the force navigated here, because we are making structural change in local investment of a healthy source to have healthy outcomes in this economic drive. Since the beginning, our farming entity has always been about local production, local sourcing, local community-driven markets. So it's all, how can we be sustainable so that we don't have that carbon footprint in bringing in our food? We're not relying on outside sources. And we are also looking at building a solar-powered food production hub for that future role in sustainability, but also in alternative energy, and hopefully be a model for other communities to start navigating their future within that.
That's fantastic. One more thing I'd love to ask you about, because this role of anchor is a very powerful role. And I know that you've linked up not only with Healthcare Without Harm, but an environmental justice coalition called Coming Clean to leverage Dollar General, which is, for people who don't know, is a store in many, many communities. It's the only place that people can go and get food. And there's 50,000 Dollar Generals around the country. And so if we're going to solve the issue of obesity and diabetes and food insecurity, we need to deal with those places in people's communities. Could you just briefly tell us what's the strategy with Dollar General?
Well, the strategy with Dollar General started to phase out their toxic chemicals. We have 3 reports. A day late and a dollar short was the first one. And then came the who's in danger. And so there's some good reports out there, as Gary said, from Coming Clean and Healthcare Without Harm, Natural Resource Defense Council, all of our national partners, the Healthy Solutions Campaign. But Dollar General was really specific. I mean, that was direct action. We started with signs outside of their stores with our neighbors, our kids, our grandkids, everybody there. And it went on to now we're at Dollar General. Dollar General within our communities are all located in low income, underprivileged, lack of what are called food deserts, and come and set up shop. 42% of their revenue comes from subsidized purchasing, from SNAP purchasing. So that gives you a big vision of who they are and what they do. So our thing is to have them invest in our communities, build wealth in our communities, and at the same time, we're holding them accountable to removing their toxic chemicals and serve healthier food options to our communities. This is a very important piece because it's really anchoring 2 different approaches to community. The Dollar General has always been this company that comes in, takes our wealth and hands it over to the CEO. We're talking about a different approach here where corporate invests in community and helps build wealth in community, at the same time is listening to our national campaign in removing toxic chemicals from their products.
Thank you. Thank you. And we'll come back to that. I'm sure there'll be more interest. Turn to NIHARIKA, former state health minister for Chhattisgarh. NIHARIKA, you directed the COVID response in the state of Chhattisgarh and had a great deal of success in containing the virus compared to other Indian states. You also oversee the health and climate program for the state. So how do you see your department's role in supporting collective response and healing in the midst of this current trauma, as well as preparing for the climate crisis?
Thank you, Gary. Just a quick and small correction. I'm not minister. I was former health secretary.
Thank you.
But I would start with our COVID response first. You know, Chhattisgarh is a small province in the middle of India with 30 million population. The southern part is hilly, tribal dominated, very underdeveloped. And the state as a whole has very low resources in terms of human resource, that is doctors, nurses, medical professionals, specialists. So it is a big challenge for us when COVID came in. We quickly did a SWOT analysis. We had around 8,000 healthcare facilities, be it a primary health care center or a community healthcare center or a district hospital or a medical college. And we had around 3,000 odd doctors in the government, in the public health system. And there would be a couple of thousand more in the private probably, and around 5,000 paramedics. But our strength was our community health workers, extension workers called Mitanins, who are women in the village who have been trained to do first aid and primary care to a certain extent and are allowed to keep certain medicine to give to the community and also report any illness that happens in the community. They were our strength. The lockdown, the government imposed a lockdown of around 60 days. That helps us a lot. We started planning our infrastructure in every district, every nook and corner to make COVID hospitals, to get oxygen supply, make ICU beds, train our doctors, train our paramedic, train our lab technician to take sample for RT-PCR, to do a RT-PCR test, and also make laboratories. In January, probably we had just one RT-PCR laboratory which could do 1,000 tests a day. But now we have at least 10 labs doing RT-PCR tests. We have true RNA testing done in TrueNAT labs, around hundreds of them. We are doing antigen testing all around. Every day we do 20,000 to 30,000 tests in the state right now. So this was the infrastructure that we had planned and we could start doing that. We used extensive IT support. We used, because we knew that it's a resource crunch is there for human resources. So we use IT platforms to do contact tracing, to keep our data, supplies data. The PPE kits had to be bought, hospital beds had to be bought, oxygen supply had to be maintained. So everything was IT based. Where the shortage was, we could click of a button, we could know that. And the most important thing we did was the vulnerability mapping. We mapped and trained our first responders according to that. The first vulnerable people were our NCD clinics gave us the reports of people with diabetes, hypertension, other comorbidity like cancer, or any other previous illness. And also, if you know Chhattisgarh, it has large mines, a lot of coal deposit. So there was a lot of air pollution already, and there were people with respiratory issues, people with impaired lung capacity. So they were most vulnerable for us. We did a mapping of them. So they were the first ones we thought that we need to shield them. We need to put them onto our radar so that any discomfort would be immediately reported by our extension workers and we'll take them to hospital, especially the mining areas. And we started our fever clinics around those areas. So anybody with little discomfort, with previous history of respiratory illness, were picked up by our healthcare professionals immediately. So that is how we planned our first response to COVID, and fortunately we did well. The numbers are rising as it is in all parts of the world, but we are in a better position to control it today.
Well, that's fantastic. And the kind of mobilization you've done and the preparation and understanding the vulnerabilities that actually fossil fuel emissions create for people around COVID is very important. It seems that it's the same kind of mobilization and preparedness and understanding vulnerabilities that need to be in place for the climate crisis. And the other thing that you've done that's been so impressive is solarizing so many clinics in your state, so that in a climate stressed world where the grid is not reliable, they can operate, anytime. Could you talk about how you did that, how you got buy-in for all that solarization?
Yes, Gary. As I said initially, the southern part, around nine districts out of the 27 districts are hilly, very remote, forest cover, and we have a unique problem there of left-wing extremism. We call them Naxal problem. So there's low voltage because the infrastructure is poor, and there was frequent grid failure due to different man-made crisis, as well as because of the remoteness of the area. We realized that energy security is key to better health services. If you have electricity, water supply, you have equipment functionality, you have a better delivery system, you have more neonatal care units to be functional, And we could retain our staff because the doctors, the paramedic who we post in these remote areas, if there's no electricity, no power supply or water supply, they don't want to stay there. They leave the government job and join the private sector. So staff retention was also a big challenge for us with that. And then the laboratory services. We thought that for all these factors, we cannot just depend on supply of electricity through the power cables. So we embarked on a journey to solarize our primary and the community health centers. There is an agency called Chhattisgarh Renewable Energy Agency. We signed an MOU with the agency and we paid them upfront to install photovoltaics on our health service centers everywhere. In the first phase, we took around 500 remote primary healthcare centers and 100 community healthcare centers. And subsequent 2 phases, Government of India supported us with money for these units. The primary care centers would have at least 1 kilowatt of photovoltaic solar plants added to that. The community health center would have 2 kilowatts maybe. And the bigger centers would need 8 kilowatts. So we did a power audit for all of them. And we also gave the maintenance contract to this agency apart from installing that. Right now, we have around 1,000 primary care centers installed with solar energy and almost 500 of our community health centers there. And we also did a study to see the outcome. It increased our institutional delivery. It ensured that there is at least the mother stayed for 48 hours in the facility, which decreased our maternal mortality rate. We had a better function of newborn care corners in those centers and newborn stabilization units in the centers. We had the cold chain maintenance done in a better way so the immunization program could be run smoothly. We also had, apart from all the maternal and child care, we also had other IPD patients being, coming, who were coming so far, had more trust in our systems. They came and got admitted in our systems. So it increased most of the indicators of our healthcare indices.
That is such a fantastic story because it links the climate smart energy strategy with health outcomes for people. And I know we're going to need to move on to LAETITIA, but you mentioned the cold storage, and that's a really important point because as we develop a vaccine for this COVID pandemic, we have this opportunity to have cold storage that's built on solar power and not fossil fuels. We have the ability to get the World Bank and others to invest in renewable energy and solar autoclaves and basically low technology, climate smart solutions for linking a climate smart world with universal healthcare access. And your model needs to be replicated around the world. So thank you so much, and we'll come back to you. LAETITIA, let's talk about the role of health professionals and the role that they can play as advocates to move governments and civil society toward more climate smart and equitable solutions. Tell us about how you've been doing that as a leader, former leader of the World Federation of Public Health Associations.
Thank you very much, Gary. So very briefly, I want to focus on 4 important aspects. As health leaders, I think we have an important role in uniting health workers, communities, and civil society organizations to work towards a common goal of environmental and climate justice and health equity. And I mean health equity in its broadest form. The second role that we have is to ensure that those individuals and communities that are most affected by the devastating effects both of COVID-19 as well as of climate change and injustice that we support them to provide leadership, and so that they can actually provide leadership for eco-centric transformation, for climate justice, as well as for equity. Otherwise, we'll be guilty of a different form of paternalism. The third important aspect is that I think we should present evidence and make sure that the issues of equity and climate justice, as well as generational justice, are put on the agendas, both of national governments as well as of international organizations. And the last aspect, Gary, is that we should also ensure that we hold governments accountable for the strategies that they put on the table. Because sometimes when you look at these strategies, they say all the right things, but we don't necessarily make sure that they implement those strategies. And we should also ensure that there's transparency around these aspects.
I appreciate those roles and those specific examples. Let's get something. Let's discuss something in your own home country. You've been a leading voice for climate and health in South Africa. Can you provide an example of how that advocacy is played out around the impacts of coal production and consumption, and how you've been engaged in that struggle? Because we certainly know to achieve any of the goals that have been set by the Paris Climate Treaty, we have to phase out coal as fast as we possibly can. So tell me about that role that you've been playing and others.
Well, Gary, in the World Federation, in our June General Assembly meeting, we passed a resolution as the Federation to call on, we pulled together all the evidence around the use of coal as energy production, and we passed a resolution urging governments to ban the use of coal for energy production, as well as, given that there's a need for some transition, to make sure that they phase it out quite rapidly. And we presented all the evidence in that resolution on why we called for the banning of coal for energy production. In South Africa, it's a very, we're very reliant on coal mines for our energy production. It's a very contested space. There has been advocacy and alternatives that activists have put forward, but we still have quite a long way to go. However, there are, as with many of these things, nothing there's not a single story or a single narrative. And so it is encouraging that in August last month, the South African cabinet actually approved what they called the National Climate Change Adaptation Strategy, which makes provision for a cleaner, certainly a revised economy that takes into account climate change, and they recognize that you can't really focus on the issues of equity and climate change without addressing some of these broader economic issues, as well. As they say, the proof of the pudding will be in the eating. And so I think as civil society organizations, we would need to make sure that that strategy or plan is actually put into, that it's implemented on the ground, and that we also ensure that communities are part and parcel of those, of implementation. And as I said earlier, one of the aspects to hold government accountable is to make sure that there is transparency around some of these actions and some of these decisions.
That's fantastic. I would say 5 years ago would have been unimaginable for a whole coalition of health professionals around the world calling for the end of coal production. Yet that is happening now. The speed of the transformation of consciousness and advocacy is accelerated greatly. I want to come back to a theme that I think all of you can speak to before we break into small groups to talk about these three dimensions of work, is that the health sector has to come with humility to this work. It's not like we're going to do something to the community. We're not going to do something for the community. We're going to do something with the community. We're going to be part of a broader healing mission with the community. And it's a different partnership model. And in that model, it elevates the role of local communities, of people on the front line, to be not seen as having deficits only, but having enormous assets in the community as partner in this endeavor. And so, could you speak about HELGA and all of you speak about the role of communities as partner and as frontline activists in this effort? Maybe we'll start with HELGA.
Yes, and I think that takes us back to where we're working with one of our local clinic here in our neighborhood, First Choice Community Health Clinic. And what we're working at is community health, because it is known and identified by our very own community that health, to attain health, is more than just visiting your doctor, being on medication if you need to. It takes more of engagement of all of those pieces of the social determinant of health. Good paying jobs, pathways to sustainability in economics, safe places to have recreation in our neighborhoods, pathways to higher education for sustainable living wage jobs. So in our vision and our work here within the South Valley, we are partnering on an eco wellness center that has food at its core, but touches on all the social determinants of health in building community health. And that came from 20 years of data from our clinic that showed that our community was not getting healthy. Diabetes was on the rise in adults and children and infants. A lot of diet-related diseases. So we had to take a different approach into what is community health. And our community, 47,000 people that visit that clinic, said all of these entities is what makes community health. That is what will make them healthier, their families healthier. So we've been on this endeavor. The First Choice Community Health Clinic, their board purchased 20 acres of land around the clinic. Again, we are in the South Valley of Albuquerque, low income. We've been out of Albuquerque. We're in unincorporated parts of Bernalillo County. So we've been left out of the growth of the city of Albuquerque. So for this community to be able to identify, be the voice, and actually be leading the change, and have the healthcare sector, again, what Gary said, we are working with community. And there's a big difference there. 10 years of trust went into building this, and what the trust built was that acknowledgement of working together to make our community healthier, to make an economic driver for a future for our children, and a future in sustainability of climate change and growing food within those struggles of climate change. As farmers, we've been dealing with climate change fiercely as of 15 years ago here in New Mexico. So this is something that didn't pop up just with, within the last, 5 years or whatever. Sure. So we've been working at this seed preservation, soil health, all of those pieces, along with production, along with community health, and building it from an intergenerational, holistic approach.
Thank you so much. NIHARIKA, do you want to speak to the engagement of frontline communities in the work you're doing?
Yeah.
Go ahead.
I just realized that it is the community which has to play a part in controlling the pandemic or protecting the environment. If you have read Albert Camus in The Plague in 1947, even there he mentioned that it's the community-led isolation or quarantine that was successful anywhere. I also realized that the government efforts are only limited unless the community accepts whether to protect the environment or protect us from the virus. So we tried and we succeeded in getting the community involved in maintaining our quarantine centers, maintaining vigil over the isolated patients. Similarly, when we talked about the pandemic, I remember talking to people and saying that, see, whether it is COVID or whether it is MERS, whether it's Nipah or SARS, they're all respiratory problems. And they are all related to environmental issues because we do not breathe clean air. Our respiratory systems are affected. We are more prone to these viruses. So it boils down to the community saving the climate, community saving the environment and the planet.
Thanks. Laetitia, do you want to have a quick word before we break into small groups on this?
Yes. Gary, I can see Heather standing there, so that's the sign that we have to stop. But I just want to add a couple of things. The first one is, I think, you know, as educated people, we shouldn't underestimate the power of information. And in some instances, I think we also, as professionals or leaders, need to unlearn certain behaviors. So we need to learn to listen and engage, and share information, and recognize that it's going to take some time. Yes, those issues of trust are important, but I think also part of it is for leaders, for health leaders and professionals to reflect and to have some introspection, and also to look at whether our own behaviors might actually inadvertently or unconsciously create some of the old biases that account for the current state of affairs. So I'll leave it at that. Thanks, Gary.
Thanks. And before I turn it to Heather, I just want to remind people we're going to break into small groups, which she'll describe in a minute. But when we come back, we'll be hearing from Maria NEIRA, who's a fantastic speaker. And then we're going to give you a little teaser of a video before we leave today. So turn it over to Heather.
Thank you so much. What a powerful group of women we just got to hear from. And a lot of gratitude for folks that had contributed that question in Slido around how do we really reimagine the partnership with communities so that people, local leaders can really drive solutions and develop strategies. So thank you so much for contributing those patterns and connections that you noted through the conversation. So given that there's at least over 40 countries represented in terms of where people are joining from on this call today, we wanted to give you an opportunity to connect with one another. And so in a moment, you'll receive an invitation to join a small group conversation in a breakout room. We have these 3 questions that we're offering as prompts for you in that conversation. And so you can see one is around leadership. We'd love to support you all to share what you're seeing in terms of actions or ideas for activating leadership that builds momentum for change at this intersection of climate, health, and racial justice. Also curious around resilience, what you're seeing, what actions or ideas you have for building community and health system resilience in the face of COVID and the climate crisis. And then the 3rd question around mitigation. And so any actions or ideas you have about how to mitigate health impacts of climate change, especially for those communities that are most hardest hit, or how we might get to the root cause of these challenges. So these questions are now up in Slido. So if you need a reminder of those prompts, you can find them in Slido. I have just dropped the link to the Slido poll in the chat. We would be so grateful if you were willing in small groups to share your responses, even high-level sort of themes that are emerging in your conversations in small groups in Slido. You'll see these 3 questions available to you. You just have to toggle out of the main room, and you'll see that each question is located in a room labeled Leadership, Resilience, and Mitigation. So we'd love it if you were able to just take a few notes in those conversations so we could get a sense of the whole. So with that, you will receive an invitation to go to a small group, and we'll bring you back at 1/4 past the hour. Folks are coming back to the main room. We still have folks migrating here, so we'll give another minute. And so you will be arriving in the main room. Thanks so much for muting yourselves once again. It's a most undemocratic feature of Zoom. We just like snatch you back, even mid-sentence. Apologies if anyone got cut off. I hope you had good conversations. There are a couple of things emerging in Slido. Thank you so much. And these themes will be available after the call to you. Just wanting to lift up some of them. So we're seeing some commonalities around leadership, around encouraging and supporting climate and health social entrepreneurs and change makers. Along with educating policymakers that climate, equity, and racial issues are all health crises. Here's the link to Slido again if you want to take a look at some of the other themes that emerged across all of the, across the other groups. Just pulling up a couple around resiliency. So resilience is preemptive while adaptation is curative was one of the themes that emerged. And this need to build community care systems so community health workers and public health systems are able to respond to this crisis. And there's so many more ideas. I'm sorry we can't walk through them all. And then related to mitigation, there's a number of ideas here. Folks, I'm imagining folks might not have gotten to upvote some of these, or maybe you've gotten to the 3rd question, but you can see some ideas that have merged around mitigation. So with that, I'm going to turn it back over to Gary so we can hear from our 4th and final speaker.
Great, thanks so much, Heather. I'd like to take this opportunity to introduce Maria NEIRA, who's the head of public health and environment for the World Health Organization. Maria, you had a chance to listen to people and to see what's coming up in the Slido and people's reflection. And clearly there's a view to integrate a lot of issues around equity and health and climate and race and recovery all together. We'd love to hear from you about how you and the public health organization are seeing these things as interconnected and the vision that's coming forward from you and your team.
Thank you, Gary, and thank you all for this absolutely fascinating discussion. More and more I see this type of networks and groups putting together their forces, their capacity, their passion, and asking themselves, how can I contribute to all of that? And just at the moment you were calling us for a plenary, if we can call it plenary again, we were discussing on a very emotional kind of statement by the lady from Botswana. I hope I can disclose this information, because she was asking herself, how can I help my own country? I'm here and I'm not providing the capacity I have to support my country. So we need to make sure that as a group, as a network here, we will find a solution for her question before we end this webinar, because I think this goes to the core of the discussion. Gary, I was thinking on what are the principles of public health. I mean, we are in a moment where the health community is very much needed in the broad sense of the health community. And I'm saying that because they need our pragmatic approach. They need our common sense. They need the way we can be holistic on how we will respond to the problems. Maybe because of the training we have, where we don't see just one disease in one finger, but we try to understand how this disease or this treatment will affect the rest of the body. So I'm 100% convinced that we have a role. And I would like to maybe test with you a kind of checklist. We need to do a daily checklist among ourselves. And the checklist will start with, are you convinced that we have a role? I'm still thinking that most of the health professionals, they are like you, like all the participants today, very much engaged, very much convinced that they have a role, but many are not yet there. So what do we need to do to convince them that they have a role to play? So I will ask on the checklist, the first question that we need to ask ourselves every day, every morning is, I'm convinced that I have a role. Because the moment we are not, we will lose our passion and our capacity to engage. Second, to start this kind of revolution of the white coats or the green revolution to protect our health, or the revolution to create a green wall to protect us from climate change, from air pollution, and from any future pandemic that might come. Do we have enough evidence? And the answer is yes, definitely. We have an incredible evidence. We have an incredible cocktail in front of us. As humans, we are putting a lot of pressure on our environment. We keep doing a very aggressive agriculture and very polluting one. We are deforesting. We are consuming and managing on a very unsafe way wildlife. This is incredible in front of a pandemic, and this is still a challenge. And of course, all of this is increasing the risk for infectious diseases like COVID-19, but we have previous examples on HIV/AIDS, on SARS or Ebola. They are all jumping from animals to humans. So this is a fact. We have a very solid evidence on that. So what are we missing in terms of convincing other people that unless we stop destroying nature, we will not put the basis for having a solid human health? And maybe we need to take the space and the role of the green activist, keeping them, of course, doing their role and fighting, and Greenpeace and all of those movements, they have been taking us here and moving a lot. But now we need to do ourselves as health professionals the same inspiring movement, because this cannot keep at the level it is now. I want to share something that since this morning, I'm feeling really very bad about it, and it gives you an idea of the contradiction we are on it. I was reading one of those tweets where the information is very short, but it was very descriptive. They were saying, please look at the health expenditure by disease category. Do you see a contradiction there? Because I see it. Health expenditure by disease category. So how can you talk about health expenditure if then you go by disease? So what you are spending on is on diseases treatment, not on health expenditure. And I've been so kind of, I don't know whether irritated or somehow on revolution since this morning, say this cannot go like that. We need, I mean, we ourselves, the health professionals, are perpetuating this wrong approach. We cannot have a health expenditure that is dedicated to treat diseases. This is wrong. The health expenditure is far beyond that. So one thing on the checklist, be convinced, ask yourself if you are convinced. Ask yourself what is your role, even if it's a global one, a regional and a small, on your network, on your NGO, at the hospital level, at home, even with your child. I mean, no matter what, it can be big or huge, but we all have a role, and more than ever, we need to play that because nobody else will do it. On the checklist, I will go for one word, but repeat it 3 times. Transformation, transformation, transformation. remember that at the beginning of the pandemic, Tedros went out, the Director General of WHO, by saying test, test, test. Well, now I'm saying transformation, 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 transformation of healthy energy transformation, healthy urban planning, healthy mobility transformation, healthy digital transformation, and healthy well-being and social justice and equity transformation. And I'm afraid more and more the role for us is there on driving this healthy transformation. That's why it's called healthy, because we have the responsibility to do it. Nobody else will understand that. I was thinking that, I think I have shared this before with the Healthcare Without Harm, that when I was a little child, my grandmother told me a story, probably without any basis or historical connotation, but she was saying that it was on once upon a time on a very remote place around the world. It was a city where the doctors were paid by the health of the people and not by the diseases they were treating. And I love it, that one, because the end of the story was that one of the doctors in one city becomes so rich that all the city was building gold, and because everybody was healthy, and he was the richest man in the country. This is where we need to go today. Today, the European Commission has made some statements about how we are going on the targets for the climate change. It's good. I mean, the targets are ambitious and all of that. They didn't use the word health. And again, we need to put the health argument there, because this is the one that will convince and allow us to go above all the barriers. So, Gary, I will stop here, you know that I can. But I would say, as the final thing on the checklist, you know, the healthy transformation is starting. So the question here is whether it's starting with us or without us. And from my side is with me. I want to be part of this healthy transformation, and we need to influence whoever is ready to be influenced. Over.
Thank you so much, Maria. I mean, a couple of things. One is moving from treating diseases to actually building health and equity and resilience in our communities as a core foundation of what the health sector should be doing in this century is just critical. And you've led this, and I encourage people to see the manifesto that's coming out of the WHO that lays out this very integrated strategy for doing so. And the other thing which I totally appreciate and join with you in helping to do is to building a movement inside of healthcare of leaders who do embed health into all of the solutions, health in all policies, because health is at the center of all of our agricultural, transportation, energy, healthcare policies, water, et cetera, et cetera. The manifesto has just been shared in the chat. And the final thing I want to leave you with now is a short video. It's a 1-minute video that is a teaser for something that's going to come out within the next month, but it speaks to that role of the healthcare sector playing a larger role in society and addressing the climate footprint. So if we could see that film right now.
I used to see black spots on the lungs, mostly smokers. Over the last decade or so, I saw teenagers with black spots on the lung. And I thought to myself, oh my God, what's happening?
The answer, it turned out, was in the air.
The interplay between climate change and health is a really important one. The bushfire experience across Australia was an extraordinary experience. Some thousands of people were in hospital. They had heart attacks and strokes, all sorts of different things.
Unfortunately, the healthcare sector around the world is a huge contributor to global greenhouse gas emissions and climate change.
If healthcare was a country, it would be the 5th largest climate polluter on the planet. 2 of the greatest health threats of the 21st century are climate change and a global pandemic, and we've got one on top of the other. If you want to have healthy people, you need to have a healthy planet.
So we'll be sharing that video with you in the next month, and it shows us that we in the healthcare sector need to heal ourselves as a way of healing the larger global community. And I want to leave you all with the sense that we need you all to be part of this global movement. Wherever you find yourself, you can lead from any seat, whether you're in Botswana or in Baton Rouge. And never underestimate the power of your individual voice, your individual activism to have transformative change. The people that you've seen on this panel are examples of that. And so I wish you all well, wish you to stay safe and healthy and be global healers, planetary healers all together. Thanks very much and have a good day.